Yeah. That's ridiculous.
Hey, Bertie, come out here, wait. We're in that gym. Sign up. Keep your sign up.
We'll make one of these signs.
We're here to support Senator Rockefeller for the first thing, and the second is that we're here. We think that we're strong believers in healthcare reform needs to happen now. It's not an issue that needs to come later. Discussions are over with, presentations are over with, but we've got to have real healthcare change in this country.
I'm here to remember my friend Karen Alexander, who died a slow death from cancer with no health care at all and left a 13-year-old daughter.
I'm here for the 46 million Americans that don't have health care. The defense a lot of people use to substitute for health care, for adequate health care, is emergency room, and that's just not enough. People need adequate health care, and I think a public option will help do that.
I'm here because it's time that the United States join the rest of the industrialized world and have a health care plan for everybody.
Okay, we're with the United Electrical Radio Machine Workers of America. We're here today to support healthcare reform. While we support single-payer healthcare, HR 676, we want to ensure that there is a decent healthcare reform plan passed by Congress as soon as possible.
Well, I'd like to support our president with the healthcare reform because if we don't do something soon, then our country's going to go broke trying to pay for health care. And right now the taxpayers are paying for health care on the back end because of increased health care costs, having to pay the people that can't afford to, that show up at the hospitals to go pay their bills. And that's one of the reasons we're out here supporting this today.
There's got to be an option out there for other people to get into. The insurance companies have had a monopoly on this for years and years. And if they've done so well in it, why do we have so much trouble here? So we've got to have an option out there where we give access to people that want to go into a different plan.
I'm against the health care plan. You know, page 50, page 300, page 900, you know, they're saying, you know, everything the government will do or can do, and I disagree with that. Plus the fact Jay Rockefeller has said he's going to vote for the cap and trade. And I can't understand why these union members or coal miners are for him when cap and trade will ruin the state of West Virginia. And not only West Virginia, but a bunch of other states, about 20 or 25 other states, if that passes. And I cannot see why union members are voting for somebody that's voting against them or their jobs. And I just don't understand why they're doing it.
But you're for Medicare? Or?
Oh, yeah, I like Medicare. I like my health insurance. And I just don't see why they're messing with it.
All we want is them to stop and take time to read this bill. I think then they're going to realize we can't, one, afford it. These children here are going to be paid for what we're doing, and they're never going to get out of debt. And two, I don't see why he is rushing it so fast. Take his time to read the bill so that we know what we're getting. What we're getting is pushing it. We're just trying to push it through, get it implemented so we'll never get it off our backs. I think we need to get the insurance companies, the drug companies, the doctors, and people together to discuss what needs to be done for us, not Congress. They don't know. We aren't stupid. That's what they forgot. The American people are not stupid. That's why we're out here. We know we're being bamboozled.
Now you're for Medicare, Medicaid.
Well, I'm really for all of it. I think we have room for all of it. It just needs to be done right and controlled like.
Why are you here today?
Because we oppose the Obamacare. We oppose everything about it. I mean, this is a free country and we should be able to choose our own health care.
So you're against the public option?
Exactly.
Is there a reason?
Well, a 1,000-page bill, which they haven't even read, haven't put any thought in it. I've tried to read part of it, can't understand a big part of it. You know, I don't like the idea of having a national health care ID card that you have to show, you know, before you can get your services or before they tell you which doctor that you're going to have to go to. I don't like the idea they're going to appoint a panel that's going to tell us what, you know, what's going to be covered and what isn't. They should be introducing tort reform so that, you know, to take care of a lot of the high costs. But there's no common sense in Washington. It's another lie, it's another stepping stone toward socialism.
First and foremost, I'm here because I'm concerned about the loss of my freedom. I'm also concerned about a government who lets Medicare go bankrupt, Medicaid go bankrupt, Social Security go bankrupt, yet wants to take over 1/6 of the economy by taking over the health care. That pretty much sums it up for me. Yes, I'm opposed to public option. I'm not opposed to reforming. I don't think anyone is. If everything is so bad, then why are they offering to let people keep what they have when over 70% of the population of the country, the polls indicate, are in favor and like what they now have?
No discrimination, pre-existing conditions. That will happen. Pass a bill. No annual or lifetime caps on annual, not lifetime. Will not happen. No gender discrimination. No, something which I really like, the idea of no cost sharing for preventive health care. This is preventing illness. Guaranteed availability and renewability for all, and it goes on and on. There's so much at stake in what we're doing, and I know that it appears to be so sloppy and be partisan. To some extent it is, I regret overwhelmingly. But what I want to do this morning is just to level with you about some things. And then be happy to take your questions. There's a whole another room somewhere where there's an overflow crowd, I think.